Hello and welcome to Pain Unfiltered, where we go in-depth into the interventional pain and spine world with some of the top key opinion leaders and executives in the space. We are your hosts, Dr. Patrick Buchanan and Dr. Timothy Deere for this ASPN podcast. Let's get started. Tim, there's less than 3 months to go now for the annual meeting. How are you feeling?
Feeling absolutely great, Patrick. As you saw, Dawit had introduced the annual agenda on social media yesterday and today. And we have amazing group of people already signed up. I think the hotel block at the Fontainebleau is almost full. And we've got great sponsorship. We've got great diversity. You name it. It's all going very well right now. So I expect us to really put on the best scientific meeting we've ever had, and also do the best teamwork, networking, and really mentoring and mentoring of each other there in Miami. So look forward to it.
Yeah, looking forward to it. I think it's become one of the premier meetings that everyone looks forward to in Miami. Can't think of a better place to do it as well. Speaking of support and sponsorships, we're excited to announce another sponsor for season 2, Nalu Medical. I love their commitment to expand the peripheral nerve stimulation data, something that's really needed in our space. Next episode, we're going to be talking to Dr. Mehul Desai, and he's going to be discussing some of their data from the Comfort RCT. Tim, just give us a couple of your thoughts on Nalu Medical and what they're doing to drive this therapy forward.
Well, first of all, we appreciate the work Nalu Medical is doing, but I think more importantly, you hit it on the head, Patrick. We need all really the folks we work with, and we have Dr. Desai, who's going to be joining us. We need to collaborate together to produce data, and data is our currency. Data is really what's going to make us be successful long term. So I applaud Nalu Medical for that. Tom West and his team have done a great job there. And working with great physicians around the country, as we see on social media, some of their partnership and the articles they publish. So I applaud them, and I really appreciate their sponsorship of this podcast.
Absolutely, Tim. And we also like to thank Mainstay Medical and Salute Medical for supporting our podcast as well. Tim, today we're going to be switching gears a little bit and taking a deeper dive into some of the stars in our ASPN community. I love these episodes. Last year we had Dr. Melissa Murphy on, another rising star, and this year's Young Innovator of the Year Award recipient as well, and she did a great job. Today we have the pleasure of speaking with Dr. Jordan Tate, Chair of the Diversity Inclusion Committee, as well as the editor of the ASPN newsletter, and Dr. Alexa Moreira, PM&R resident at the University of Miami. Thank you guys for both joining us.
Thanks for having us.
This is so
absolutely
awesome.
So yes, thank you. So let's just dive in just real briefly about your training, your background, and kind of why you guys chose ASPN. Jordan, we can start with you, and then Alexa, you can go after her.
Sure. Thanks, Pat. I'm down here in Atlanta, Georgia area, interventional pain doc, private practice, and have been out in practice since 2014. Did my training at Vanderbilt, Emory, and Mayo Clinic. Love to be engaged in our field. Any opportunity I have to get out and travel and really expand my horizons and break through the solo private practice kind of mode that I have going on here is always a great opportunity. So part of the reason I love being in the ASPN community is really to explore those relationships, the networking opportunity, as well as the many opportunities that I've had to work with amazing rock stars in the field, researchers, really contribute to the data in our space and work on some foundational, groundbreaking evidence building publications. So for those reasons and many more, excited to be a part of ASPN and really appreciate the opportunity to come on here.
Thanks, Jordan. Yeah, we'll talk about what you've done so far with ASPN and also the women in medicine as well. You've done an outstanding job and really is a huge asset to the society. Alexa, why don't you go ahead and introduce yourself as well?
So I was born and raised in Michigan originally. Moved to Georgia and did my training, my biomedical engineering degree at University of South Carolina in Columbia, and then med school at MUSC in Charleston. I'm currently a PGY4 PM&R resident at the University of Miami. And why I chose ASPN. So coming from a resident perspective, interested in, pursuing a career in pain, I put myself out there as a PGY2 and went to, the data reveal in Las Vegas. And that was like my first hands-on cadaver lab. So, the courses that I have for education, career building with the Young Innovators program, which we'll get into in a little bit, and opportunities for networking and were some of the main driving reasons why I joined ASPN. And also the focus and emphasis on the welcoming of mentorship for the aspiring docs in pain medicine.
Thank you so much, Alexa. And like I said, you're way ahead of the curve right now. So, we'll talk a little bit more about that, but thank you also for joining us. So, Jordan, we'll start with you, talking a little bit about kind of the current state of the women medicine. I think there's a need for more representation, as well as, highlighting some of the great work you guys are doing for the society and for medicine in general. So can you kind of just talk about kind of the general landscape right now of the women in this field, and kind of talk about your mentorship program too, and how you're helping out in that area as well?
Yeah, so, in both interventional pain management as well as neurosurgery, interventional radiology, and some of the other fields that are represented at the ASPN society level, we are a minority, us women, and old data from 2018 looking at interventional pain management cites about 18% of IPM docs are female. So we know that that's even a more skewed minority when it gets down to who's performing more advanced procedures in our field. I was talking to one of our SI joint fusion companies, and they were talking about how, they've had tens of thousands of procedures done in the U.S. and less than 100 were performed by women. And so, there's a lot of unrecognized biases and barriers to getting more women involved at the society level, research level, getting more women on the podium, and exploring a lot of the opportunities that are available in ASPN. And so, for that and many other reasons, I've made it a bit of a life's mission to make sure that I represent women in our space well, that I get involved and stay involved, and that I look for opportunities to pay that forward by developing initially an informal kind of mentor-mentee relationship with several younger females, and in some capacity it's become more of a formalized program more recently.
That's fantastic. Alexa, do you want to share your experience with the mentorship program and how that's kind of shaped your career as well?
Absolutely. And it all really started, I believe it was, I first, had the courage to introduce myself to Dr. Tate. Cause, from a resident perspective, in training, you see all these, well-known, pain physicians in the field who are, trailblazers essentially. And you're kind of a trainee still, and you're kind of nervous to even approach them or ask, hey, how do I become you one day? I just want to be just like you, And so I remember after the cadaver lab, there was a cocktail hour hosted by ASPN, and, I just introduced myself, and it turns out, she was also from Georgia. We had a lot in common, and I was like, maybe I could shadow you if that's okay. I just asked, and she was very receptive and very encouraging. And since that point, I set up a rotation with her, and that's led to, interest sparked in some of my co-residents as well, who have also spent time shadowing her and having her as her mentor. And so, I think she has been a great mentor as far as, really leaning into opportunities, and, showing a really good example of what it is like to have a work-life balance with a family, wearing all these hats, essentially being an industry leader, key opinion leader, and involved in these clinical research trials and running, a business. And that's just very impressive. And so I think she's a great example for many women in the field. And I'd love to pay it forward one day. And, just really grateful.
Yeah. Story all began at Aspen, so it's quite a full circle moment that we're having right now. But, I think from the moment I met Dr. Moreira, Alexa, she was very confident and really excited to, be a sponge and learn from me and ask lots of questions and be very engaged. And I think that is, the hallmark of a great mentee. And having the opportunity or the willingness to travel and really put herself out there, I think is something that listeners who are, maybe thinking, I would like to have a mentor someday or, be a mentee. Those are the initial steps. Listening to what she said, one of the things it probably echoes with a lot of us is that, you get this sort of celebrity type status that we apply to several people, especially, executive directors of big societies or people who are very well published. And you kind of forget that they're just pain docs, or they're just neurosurgeons, and they're just humans too. And, if you can kind of take that opportunity to remove the celebrity status, most people in our field are more than willing and very excited, at the opportunity to help anybody else who's coming behind them. So.
I'd like to ask both of you a question, but I'm going to preface it by some examples and then see if you can give me some times this has happened to either one of you. So years ago, there was a neurosurgeon, Dr. Sherry Apple, came to Charleston, and she applied for privileges. And there was two people in this committee who tried to stand in her way for really inappropriate reasons. And so I befriended Sherry and fought to help her get through credentialing. I was on that committee, and she went on to do extremely well and really change the community. And then quite a few years later, I met Erica Peterson when she was a resident, and she came and asked to get involved with Aspen. And then she proved it. There's two parts, right? You have to show up and then ask. If they don't ask you, you have to ask for yourself. And as you know, Erica now is president of our society and created the Poster to Podium program. And then Natalie Strand reached out to me several years ago, and I was really happy that I was able to post with her full professorship. She said, I really want to write articles. And we started working together and writing a lot of articles. So I guess the question for you is, when have you seen a barrier where someone, you've asked for something and then that's worked out to change your career in a positive way? So maybe start with you, Jordan, and then we'll go to Alexa and kind of get your thoughts on people who've really helped propel you. And I know Jordan, you're right now propelling so many people. I'm so proud of you and all the things you're doing. Tell us a few examples, or maybe one example when that's happened in your career.
Sure. I think the first thing that jumps into my mind is with my old practice and, being very transparent, I was staying at a kind of level salary position that I felt was unfair and not commensurate with the work that I was doing. And I went to a Women Neuromodulators Network event, and I remember Jessica Jameson talking about a book that she had just read, and the title of the book was Women Don't Ask. And I went home and I bought the book. I read the very first few paragraphs. I actually never finished the book because I read those first few paragraphs and I said, exactly, what am I doing? Why am I not asking for what I want? Where did I get this idea and this mentality that if I just do well and be good, someone will eventually notice and give me my due? And instead I said, absolutely not. And I just put the book down and called the CEO and said, listen, this is what I want. This is what I deserve. And he said, I completely agree. What took you so long to ask? So thank you to Jessica.
Yeah, Jessica's great. I do think you have to ask sometimes, though. You show up and you do things, but sometimes people don't know what you really want in your career or what you're doing. So, great story, Alexa. You want to add to that?
Yeah, absolutely. So, actually, so throwing it back to you, Dr. Deer, after, asking, if I could shadow you and then spending time with you in kind of like a hospital-based setting, in a community, in a smaller community, basically my time shadowing you has, also helped in my career as far as, getting involved with, the ASPN neuron guideline writing, collaborations on different projects, more like different scholarly activity. And I think that's really helped give me more opportunities being involved with the Young Innovators program as well. So, gratitude towards you as well. And, I've had multiple mentors that have helped, but one thing about me, I'm really not shy to ask for help. I just kind of, I know I don't know everything, and essentially I want to be in your shoes, essentially. And so yeah, I'd encourage listeners that are on this that are listening to this right now. Maybe you're on the way home from work or at the gym listening to this podcast or something, but really just not being afraid to ask, and kind of getting out of your pride and learning something from someone. Even coaches need coaches. And I think it's really important that you recognize that there's always room for growth. There's always room for improvement. So you can, show up as a better version of yourself, for your families, for your coworkers, for your patients. So.
Great.
Thank you, guys. Yeah, that seems like such a simple thing to do, just ask, but it's really changed a lot of people's careers. I mean, this is how the podcast started. I went to Tim and I asked, hey, Tim, how do I get more involved in ASPN? And he said, if you have any ideas, let me know. I was like, well, I'm thinking about this podcast idea. What do you think about it? And that's how this happened. So absolutely, asking, people for advice or what they can do, I think is huge. And I think that just talks so much about the society too as a whole. So let's talk.
Pat, I was going to say,
go ahead, Tim.
That was a great idea. And when you came to me with that, and I said, man, that's a brilliant idea. So good job. You've certainly impressed me with what you've done so far. We're only in season 2 though, so you got a lot more work to do.
That is true. That is true. So so far so good, but yeah, we're always striving to do better. I appreciate that. Let's dive into a little bit about the podium program. And I think this is, like you mentioned, Tim, Erica Peterson brought this out. Melissa Murphy was involved with it last year. And Alexa and Jordan, you guys have experience with too. Can you get a little talk about that and kind of what your involvement with that is as well?
Sure. So, I mean, it's an awesome program. It's in its second iteration. And the idea is to get the young innovators, residents, fellows, more access to direct mentorship, to really get them from the beginnings of an idea all the way through setting up either a small feasibility study or survey-based study, something that they can do in their local clinic, or can work with their mentor if they have any active research that's ongoing. And together they can hopefully put together a small publication, a poster, and really have the opportunity to then experience presenting that information to their peers at our annual meeting. And this is Erica Peterson's baby, but it's really been quite successful. And I know Dr. Moreira has been working on it with Dr. Lubenow as her mentor. And then the aforementioned resident at University of Miami, that's PGY3 currently, Dr. Robin Mata, is who I am currently mentoring in the P2P program. And she and I put together, I mean, all credit to her, all of her idea. And I just helped kind of give her some feedback along the way, but put together a survey that actually did go out to the entire ASPN listserv about a month ago. So anybody who's listening who didn't fill out that survey, if you want to go back into your inbox and check that out and trying to accumulate some normative data on current spinal cord stimulator trial practices across our peers. So excited to see the results of that study. I think it'll be very interesting. You know, we had a big talk about this at the Sonoma Spine Summit with Dr. Dorsey, and several of the neurosurgeons were commenting about how interesting it is that so many of the interventional pain management docs perform trials in quite a variety of ways, right? You know, there's 3 days, 5 days, 7 days. There's, paresthesia-based, testing and anatomic placement, and following the NAC guidelines, not following the NAC guidelines, keeping people on antibiotics, not keeping people on antibiotics, right? And you talk to people and everybody has their anecdotal reasons why they do or don't follow some norms, but we're hoping to get some data together to understand that a little bit better. So, and I know Dr. Moreira has some interesting experience she can share with that program as well with Dr. Lubenow.
Yeah. So basically, I'm very excited to be involved in the research, the clinical research trials that are ongoing at Rush, and this program, served as a great opportunity to get a head start on research while I'm still in residency, and kind of transitioning and continuing the project while I'm a fellow. So basically, the project is very interesting. It's a randomized controlled trial, single-blinded crossover study, looking at patients with CRPS receiving dorsal root ganglion stimulation at 2 different frequencies, a lower frequency and a high frequency, and as well as looking at intermittent dosing versus just continuous dosing. And so I'm going to be presenting the single arm data because it's like a 25-week study, but at least 12 weeks will be presented. So that data should be pretty interesting, and I plan on continuing on collecting more patients to enroll in the study, and that can be kind of a foundation for more projects when I start as a fellow.
That's great. Looking forward to hearing. Go ahead, Jordan.
That's a great opportunity. I'm just thinking back to when I was a resident, and how amazing it is to have this opportunity that Aspen has built. Such a great idea, and it's awesome to see it come to fruition. It's going to be really cool.
Yeah, and to be with Tim Lubenow too. What a great place to be for that. Tim, one of the world's best DRG stimulators in the whole world, and I think some of his younger faculty are pretty impressive as well, which we may hear about in a little bit.
That's a great segue, Tim. Look at that. So we'll go into our last section. We're trying to get more Aspen members involved in the podcast, and I think a great way is to highlight them and bring them up and ask some of the guests some questions as well. So Tolga Suvar, you're making history today. You are our first Aspen member. Honored to ask the guest the question. So just want to thank you for coming on. I know you had a busy schedule as well. Just introduce yourself and kind of your training background and why you chose Aspen.
Oh yeah, thank you, doctors, for having me on board. I really appreciate the opportunity. And we've really, through Aspen, have been able to collaborate, and we've had the opportunity to discuss ideas, to discuss research topics, and really, you've all been mentors to me. So again, this is an honor to be on the podcast. I trained at University of Arkansas for medical sciences. Dr. Goree was a program director when I was down there. That's where I actually ran into Dr. Peterson as well, and she was tremendous. She's definitely given me some insight into how to progress my career. I did a 1-year interventional pain fellowship at Rush University. This was between the years of 2019, 2020, slightly hindered by the pandemic, but we made it through. And I decided to stay on board, mainly for collaboration. Dr. Lubenow, Dr. Bhuvanendran, Dr. Amin, Dr. Jaycox, we've had some tremendous mentors over there. And so for me, it was a continuation of what really makes Rush elegant and what makes Rush great. And for us, it was the exposure, the volume, the breadth, the complexity of cases. And so I thought it was a great place to start my career. And who knows, maybe I'll be here 30, 40 years later. I am also director of cancer pain at Rush University, so really excited about that, treating patients with cancer. And also, I will be the newly minted program director at Rush University starting July 1st. So I love this platform, and thank you for giving me the opportunity to announce that. Why do I love Aspen? It's really an opportunity for young physicians to become involved. That's predominantly why I got involved in Aspen. It's an organized pain society. It allows me to get involved with panel discussion as well as leadership roles. So really, again, the collaborative efforts among our peers is what's really important.
Thanks, Tolga. That's great, and congratulations on the new job. I think you're going to be shaping a lot of young lives too as well. So that's great. And like Alexa said, to pass it forward and move on. You had a couple questions for the guests of the panel here?
Yeah. So again, thank you for being on the panel. What was the major deciding factor for choosing a place of fellowship training? Both Dr. Tate and Dr. Alex, I think this is a good question if you want to maybe just divide it up, and I'll have a follow-up question after that.
You want to go first, Alexa?
All right, I'll go first. Okay, so I chose Rush really because it has a phenomenal reputation for having a robust surgical training. And incorporating and being exposed to pretty much all the advanced procedures in pain medicine, using all the therapies across the board. And the volume of patients you see during that 1 year of fellowship, that was like my priority, picking a fellowship. I really wanted to pick a spot where there was great mentorship, great education, opportunities to learn from different, different industry leaders, to learn about their therapies, outside of work, and have ample opportunities for research. And yeah, so those were really the main things. And I saw, firsthand, I actually, took a week of my vacation time to do a visit at Rush, and I introduced myself to Dr. Lubenow at a conference, and mentioned my interest in learning more about the program, and getting firsthand knowledge and experience from being there, essentially. And so he invited me to come for a week, and I got to see firsthand the fellows, were all happy, and it was kind of like a team mentality of taking care of, a big patient load, I guess you could say, and on busy clinic days. But everyone really expressed, that they had like the best training that they could ever ask for. Job opportunities, were ample and available, and they were often, sought after during fellowship. And yeah, so those are, the main reasons, essentially, why I chose Rush.
I figured I'd let her go first. It's a lot more fresh in her mind. This is a decade-old decision I made, I guess. But yeah, I mean, I think for those, who are listening, who are maybe residents and thinking about fellowship, there's a lot to unpack. I mean, I think you have to think about where you're going to be happiest and where you're going to thrive, what kind of environment you're looking for, and understanding, as best you can, ultimately what your goals are. Do you want to be a renowned researcher? Do you, want to have more, make sure you get all the advanced skills? For me, one of the things I was drawn to, I went to Mayo Clinic in Jacksonville, Florida, was that it was a single fellowship, which had pros and cons. But what I saw there was that there was a very close relationship with the fellows and the attendings. And I had 5 attendings, and one was PM&R, one was anesthesia, one was neurology, one was interventional radiology, and one was pain psychology. And I really love that idea of being able to learn independently from the variety that was available there. And I thought it turned out to be the right decision for me, and it was an amazing environment. One of the other great things I got out of fellowship was the fact that being the only fellow, there was also one spine fellow for the neurosurgery department. And so he and I scrubbed in on all the implants together, and learning to sew from his 7-year residency experience was wonderful as well. So I think anybody who's thinking about fellowship and maybe not asking kind of those questions, am I going to get the opportunity to implant? Am I going to have any independence? And if so, who am I learning from? It becomes quite a relevant topic ultimately.
Yeah, no, I certainly agree with all of that. And thank you for sharing those insights. I think kind of in my experience, where you train, you build a lot of connections. Really, that circuitry and that network is very important. So kind of where you train, the geographical location is important. Doesn't necessarily mean you have to stay in that area after fellowship, but certainly it's important, right? And I think societies like ASPN can give you that full breadth and allow you to kind of expand and reach people outside of the area of training. So what else? So I have a question. This is a little bit of a fun question, Dr. Tate, and please, Dr. Buchanan and Dr. Deer, share with me, but what is one of your favorite interventional pain procedures?
Yeah, that is a good question. I always say, or I have always said for the past couple years or so, is posterior SI fusion. I don't know what it is, but there's something about it that I find really fun. Sort of like video game style, and I'm not a gamer by any means. I think Patrick with his headphones right now, he probably is a gamer. That's always been my answer for the past couple of years. I think, there's lots of new stuff coming out that we keep training on. I recently did some kind of cool lab work on some endoscopic intradiscal stuff, and that might rise to the top in the near future.
Yeah, you took my answer, Jordan. I really like posterior SI fusion too. I think it's a little bit of a learning curve first in terms of getting the images set up and guiding that through. But once you get it done, and the patients that come back even 10 days later, you can kind of see that amazing relief right after, almost instantly. So that's great. Another procedure that I'm starting to really like and getting good results with is the intercept procedure too, kind of like a kyphoplasty / RFA kind of combination. So that's been pretty enjoyable to do too.
Gosh, you guys took two great answers. Tia, it's like on the board. So I do love both those procedures a lot. I would give you that. I think the posterior lateral arthrodesis, the Minuteman procedure is great. I really enjoyed that procedure a lot. I've seen such great outcomes from it. And a lot of times those people are sent to me by my neurosurgeons who the person's too old or too sick, or they're a younger person who just doesn't want a larger fusion. So we've had great results with that. And then I still love DRG. It's probably my other favorite procedure, and cervical DRG, lumbar DRG, all those areas. And really that's because it's almost like a ballet with the lead. You're either really good at ballet or you suck at ballet. And so if you're really good at ballet, I think it's a great procedure. And the outcomes of all the things we just mentioned, of all four of the things we just mentioned, and many other things like mild and peripheral nerve stimulation, we're seeing such good outcomes, Tolga. And I think that's what makes it so much fun. You have fun doing the procedure, then you see them back in the office a month later, and they say, "Thank you so much for changing my life." And that's what we want to hear. That's why we're all here, So that was a long answer, but the other two folks took some of my answers already.
And Dr. Moreira, what are you most looking forward to at Rush University? How can we achieve your professional goals at Rush?
Oof. I'm just honored to be there, honestly. I know that, I guess it's an exciting time to be at Rush with you as new leadership as well, but not to brown nose or anything. But also it's an exciting time because we're including more diversity. as a PM, coming from a PM&R background, and also my future co-fellow boss, he's also PM&R, and this is the first time ever of having 2 PM&R fellows in the class. So everyone else has been primarily from an anesthesia background, but I think, we're seeing more of a shift in having and seeing the importance of diversity in your team. And so that's something that's really exciting for me. But also, getting the opportunity to, be like a kid in a candy store, essentially, like seeing, all these different types of therapies, all different companies, really seeing the differences in patient outcomes firsthand, not just kind of pigeonholed to one brand or one company and this is the way we do things, and really seeing things full circle, from trial to implant and all of those things. Those are the things I'm really looking forward to. And then also just kind of, I've heard the food scene is pretty nice in Chicago too. So
yeah, we have some pretty excellent journal clubs, that's for sure, outside of the hospital setting. So we'll get to have fun, and perhaps maybe if Dr. Lubinow was watching, he can take us sailing out on Lake Michigan. So that'd be great. But certainly, we have a diverse caseload at Rush. And so I think being exposed to all the different neuromodulation companies, all the different breadth of procedures, going through the literature and really having an opportunity to publish some research is going to be excellent. We have a powerhouse of fellows coming in this year. You included Alexa and Ramandeep as well, 2 powerful females that I think are going to definitely keep the boys on their toes. So it's going to be great. 2 PM&R residents, 3 anesthesia residents. So we take about 5 fellows each year, and we're really excited for this upcoming class.
Awesome. That sounds great. Well, thank you, Tolga, for coming on and sharing your experience and your questions with us. We'll just have a last segment for closing thoughts. Just want to thank you guys all for coming on. I think this was a great segment, highlighting, what you guys have done, and also, there's plenty more to do, and your advice and your thoughts and your leadership on all these things. It's been really great to see. Tim, do you want to say a few words?
Yeah, just, when you start any new adventure, you think, well, is this worth it? So looking at the 4 of you here, I think the future of the field is so strong. Watching Jordan develop over the last decade and see her success, and now seeing Patrick, your success, and Tolga, I met Tolga when he was a fellow, and seeing his great work, and now Alexa's a resident. So I think if anybody watching this podcast or listening to this podcast right now, what they can realize is that the field of interventional pain and spine is going to get even stronger. We've done some things so far, but it's going to get even better. And I think people like all of you gives me great confidence that patients are in great hands. So thank you all for coming on. It's been a real honor to be here with you.
Thank you so much, guys, again. Well, this wraps up episode 3, season 2 of the Pain Unfiltered podcast. Thank you guys for joining us.